Good morning. Good morning. All right. We're a smallish group with a big ambition, right? With a lot of energy. That's why we're all here. So welcome very much to the National Academies. I'm Victor Dzau, the president of the National Academy of Medicine. And, you know, I just want to welcome you to this really important workshop entitled Health Systems Intervention to Prevent Firearms Injury and Death. I just think, having ran previously the Duke University Health System, I know how important all of you are and that you're the front line, and this issue is really going to be very relevant to what you do, and by coming together, we can come up with some really great ideas and collective idea solutions. So the genesis of this workshop dated back to March 2018 when I got an email from Eric Larson, who's the Research and Care, Vice President of the Research and Healthcare Innovation at Kaiser Foundation Health Plan here in Washington. And he emailed me and said, look, we're really interested in talking to you and follow up on possible work and actions in light of something I wrote in our website, and then some op-ed notes about the gun violence report. And so this is shortly after the shooting at the Marjory Stoneman Douglas High School in Parkland, Florida. He offered to connect me with a couple of his key colleagues at the Kaiser Permanente, David Grossman, who's here, and also Bakra Chokar, who's obviously, both of them are here, and a major drivers of this meeting. So soon after that, the four of us talked on the phone, and they indicated, that is, David and Bakra said, they'd like to do something about this whole issue. And what came across to me is how committed they are and how passionate they are about doing something. And I was impressed with the fact that here I'm hearing from individuals running healthcare system in the front line who feel that they could do something, they want to do something, they want to activate something in this very important issue. So we discussed the options and came up with the idea of a workshop. The workshop, to me, is a beginning. It gets interested people together to talk about the issue, experts to look at the issue, and eventually, hopefully from the workshop, you collectively think about how to move forward in addressing this really important issue. So they said, look, Kaiser's willing to sponsor the entire workshop. I said, boy, that's really generous. If you ask Rose Martinez and others, we spend time just trying to get sponsors and a good idea, and the fact that you're willing to do that. But I did say to them, you know, it will have even more impact if you engage other organizations so that more people in the health system become more aware of this issue, obviously very much driven by Kaiser. And so it's really good to see the American Hospital Association being involved here today as well, of course, and many, many of you. I want to thank a whole number of people, the planning committee. George Isham, he says this has been a record speed in pulling this together, but I know you can do it, right? And Rose Martinez, of course, who's been so central, you know, in making all this work. She's the director of the board on population and public health, and of course, Melissa French, who organized all this, and staff who's made this really important. So I just want to say a few words about the topic of gun violence. It's very important to us at the National Academies. It's important to us as people involved with the health of the nation to recognize that this is a defining public health challenge of our time. 2 days ago, and Therese was there. Where's Therese? We had our annual meeting. George, you were there too. And I opened my remarks and speech talking about the challenges that we face in this nation and the public health crisis. And I highlighted that gun violence is certainly one of them and that we should tackle them. The burden of firearm-related violence is a major topic. It should be a major topic for public health in this country. Just consider numbers. In 2016, firearms accounted for more than 38,500 deaths and more than 85,000 injuries. At least 15,000 people died because of guns last year in the U.S., and that number excluded suicide. In fact, 3 of the deadliest mass shootings in modern United States history occurred in a span of less than 6 months. And of course, you're well aware of Las Vegas and what happened in Florida. I think that these events have only heightened the focus that we all need to have on gun violence and the need to take actions to prevent it. You know, when you come to an issue as complex as gun injury and violence, it does take a village, if they say, to work on this. And that's, I think, is where we all come in. Because you need prevention to intervention, you need a range of stakeholders from health providers, health systems, to researchers, to policymakers. So the way I look at it is that we want to have multi-sectoral engagement and solutions. We have to have a focus on public health and prevention. Therefore, we need policy to promote public health and prevention. Therefore, we need research for policymakers to make decisions on evidence-based issues. And we need practice. So that's why you're here, that's why I'm here, that's why many other people are here. So if you look at public health measures, and I know George would mention about this, we've been effective in motor vehicle injury, tobacco use, drownings, etc. So why are we not doing much on this area? So to begin, at least from our perspective, we need good public health research to understand the issues, the causes, the triggers, the preventions, etc. And there's no research in this country supported in this area. In 2013, after tragedy in Sandy Hook, President Obama directed the federal agencies, CDC, to mount a research initiative. And CDC came to us, then the IOM, and we produced a report called Priorities Research to Reduce the Threat of Firearm-Related Violence, which laid out the priorities of what we need to be done for the next 3 to 5 years. And you know what? Nothing happened. But what we laid out still totally pertains to today. Nothing happened because the fraud politics of the issue have prohibited CDC and others to support research in this area. That's because of a misinterpretation of the Dickey Amendment, political or otherwise. And Mark Rosenberg and I and Alan Leshner and I wrote a number of op-eds and editorials to push back on this issue. And this has been a small victory because the 2018 Omnibus Funding Bill, Congress did include explicit language saying that federal support research is allowable. And so that cleared up a long-standing misunderstanding of the Dickey Amendment. But unfortunately, as you know, no money has come this way as yet. So we need to work hard on this issue. But today I want to say that beyond research, there are many other factors ranging from how securely are firearms stored to complex predictors at societal, community, and situational individual levels to many facets that can be touch points for injury and intervention. And here's where the health system and providers come in. As a statement of task or perspective from this workshop says, many health professions find themselves on the front line of treating patients injured by firearms in the emergency room. These and other professionals at other healthcare touchpoints, for example, primary care, behavioral health, specialty care, and others, may be well positioned to reduce and prevent death and disability related to firearm violence. So we need strategies to lower the risk of firearm violence employed by all of you, the front end. That could include patient education, counseling, assessment of access to firearms at home, identification and assessment of domestic violence, trauma service intervention, linkage to community violence prevention effort, and we need data. So I would simply say to you, your conversations will be so important in touching on many of these issues and helping us find a roadmap going forward. So that's the reason that we're here. Our job at the National Academies is to help convene, catalyze, and maybe come up with, eventually with formal recommendation if we go through a consensus study. And so in so doing, this workshop, again, thanks to Bakra and David and others, have really catalyzed us to together look at the current state of evidence of intervention, practices, what are the best approaches to disseminate and implement evidence-based practice, community linkage, and of course, the scope and programming of future research. So I've taken too much time, but I do want to thank all of you for being here. You know this topic is very meaningful to all of us. And again, I want to thank the people for making this happen and catalyzing it. So with that, I do want to introduce, therefore, Bakra Shoker, who in fact is one of the engineers, architects behind this. He's the Senior Vice President and Chief Community Health Officer at Kaiser Permanente. He oversees organization's national community healthcare efforts and philanthropic giving activities, someone we should all know. But those are aimed at improving the health of its 12 million members and 68 million people who live in the community it serves. Prior to joining Kaiser, he was a commissioner of Chicago Department of Public Health for 5 years before serving as Senior Vice President of Safety Net Transformation and Community Health at Trinity Health. So in 2018, Dr. Shoker was named number 10 on the modern healthcare list of the 50th most influential health executive in the U.S. Please help me welcome Bakra.